Yes, sir.
Welcome to the next session of LMHI Global Colloquium 2021. The theme of the current session is Experiences in Cancer and Chronic Disease Management. I, Dr. Mohit Mathur, along with Dr. Rekha Thomas, will be the moderator for this session. And now I would request Dr. Rekha, first of all, to please introduce the chairperson for the session.
Welcome, all of you. Today, we have two esteemed personalities chairing this session. We have Dr. K.S. Sethi. She has served as advisor, Ministry of Ayush, and at present, she is working as senior CMO, CGHS Ministry of Health, Government of India. Welcome, ma'am. We have Professor Michael Frost. He is specialist in internal medicine, and he has served as head disease of clinical oncology, Department of Internal Medicine, Vienna, Austria. Welcome, Professor Frost. We have a panel of distinguished speakers who will be sharing with us their clinical experiences. Looking forward to a creative and fruitful session. Now, I would like to request Dr. Mohit to please call upon the first speaker with the permission of chair. Over to you, Dr. Mohit.
Thank you, Dr. Rekha. Now, I would like to first invite Dr. Professor Lakshmi Kanta Nanda. Professor Lakshmi Kanta Nanda is former principal cum superintendent of Dr. A.C. Homeopathic Medical College and Hospital. And before I invite Dr. Nanda, I would request all the speaker to please kindly limit your presentation within the prescribed time limit. So, Dr. Nanda, please share your presentation.
Good evening to respect chairpersons of the session, all manager, and my co-speakers. My topic is today an observational evidence-based study on the effect of constitutional medicine vis-a-vis keynote symptom-based medicine in treatment of pre-malignant conditions. As we all know, next to heart attack, malignancy is the next leading cause of mortality. Homeopathic approach to pre-malignant conditions will be discussed in this presentation with evidence-based reports. In the background, we all know that when a good prescribing totality is present with a patient, homeopathic prescription is always based on totality of symptom, which is known as constitutional prescribe. In some pre-malignant diseases in initial stage and also in very advanced stage, pathological conditions, constitutional symptoms are lacking. In such cases, another area of selection made on prominent characteristic symptoms known as keynote prescribing. And as we all know, according to aphorism 153, Hahnemann also emphasized more striking uncommon symptoms are solely to be kept in view. More general and undefined symptoms like loss of appetite, debility, restless sleep, and also so forth demand little attention if they cannot be more accurately described. So these symptoms, the so-called general symptoms, are observed in early onset or advanced stage of pre-malignant diseases and requires keynote basis of prescription. So with this background, my objective of the study is to have a statistical evaluation of effect of homeopathy on pre-malignant conditions, to compare the effect of constitutional method vis-a-vis keynote method of prescribing in pre-malignant patients. Method is a non-randomized, observational, retrospective study from patients' case records treated for pre-malignant conditions prescribed on basis of constitutional method and keynote method according to their manifested totality. This is important. And common pre-malignant conditions included in this study are leukoplakia, mixed salivary gland tumor, cervical intraepithelial neoplasia, uterine endometrial hyperplasia, low-grade glioma, and schwannoma. Inclusion criteria: the patients whose diagnosis is based on histopathology, CT, ultrasound, and tumor marker tests are included, whose pre and post treatment investigation reports are available, are also included. The age group distribution is 15 years to 70 years. Exclusion criteria: patient with malignancy or with other adjuvant treatment are excluded. And 30 caretakers, 15 from constitutional and 15 from keynote group, who were followed for 2 years, were selected for statistical evaluation. There are 16 females and 14 males. And selection of medicine, the patients prescribing totality, when there is a good prescribing totality, the patients are prescribed constitutional medicine. When there is a paucity of good prescribing totality, prescribed on dominant characteristic symptom, that is keynote prescribing. Potency, LM potency for constitutional group and centesimal for keynote prescription. Repetition following principles laid down in organ of medicine. My totality is like this, as we all know, but for keynote, I have fixed one parameter that to select a medicine keynote, at least 3 keynotes must be with the patient, that is from 3 different areas, one from mental, one from physical gender, one from particular, or 3 keynotes pertaining to mental general can be taken as basis of keynote prescription. Looking to the patient profile, see cervical intraepithelial neoplasia, grade 1, 2, 3. I got 4 patients. Okay. So, in my this study, I have treated CIN, cervical intraepithelial neoplasia, 4 patients, endometrial hyperplasia, 4 patients, low-grade glioma, 3 patients, leukoplakia, 8 patients, salivary adenoma, 6 patients, schwannoma, 5 patients. Total 30 patients, and out of 30, 15 patients were given constitutional medicine, 15 patients are given keynote medicines, depending upon their totality, not arbitrarily, not on randomized. It is according to the presentation of symptom. Who are with the paucity of totality, they have given keynote. Who are giving a good prescribing totality, they have given constitutional medicine. My parameter of assessment, that I assessed the improvement on these parameters basing on size of tumor, which are assessed by pre and post MRI, CT scan, pre and post histopathological reports, pre and post tumor markers such as CA125 with US reports. Parameters: size of tumor, if there is to tell it is marked improvement, there is a gross reduction of size of tumor, that is 0 to 1 millimeter, partial improvement, partial reduction, that is up to 50% reduction, and no improvement, no reduction. Histopathology report: absence of dysplastic cells are marked improvement, presence of dysplastic cells, no improvement. Tumor marker within range, marked improvement, above range, no improvement. Visual analog scale, pain and lesion absent, complete absent, marked improvement, partially present, partial improvement, no improvement, no change in lesion. And there is also a study, quality of life assessment, where I have applied the pre and post KPS score to calculate how much the quality of life improved. So coming to the result, see, out of 15 cases of constitutional group, 7 has marked improvement, 5 has partial improvement, and there is in 3 cases no improvement. In keynote group, out of 15, there is no marked improvement and partial improvement in 12 cases, and no improvement in 3 cases. So this is the statistics, individual, but I cannot go detail. So see, 24 out of 30 cases, 24 improved, 6 not improved, and I have applied one sample person test for evaluation of homeopathic medicines on pre-malignant conditions. And you see, when calculating both CP plus KP, there is a marked improvement, significant improvement with the p-value 0.001. And when only calculating the keynote prescription improvement, there is p-value is 0.038, which is less than the total sample test, and that is a little lower than the basis of the homeopathic improvement in general for pre-pregnant conditions. And in KPS score, you see Before treatment, it was 65.33%, and after treatment, it is 81.67%. 81.67% means the patient is able to maintain his life, able to do his daily livelihood. So coming to some few cases, because I have told you that my cases are evidence-based, I will show you two evidence-based cases from KP group, that is keynote group, and two evidence-based cases from constitutional group. This is a case of KP group. You can see a leukoplakia, frank leukoplakia, July 2021, August 21, September 21, October 21. You see visible improvement gradually occurs from in each month. This evidence is supported by reports from All India Institute of Medical Science. You can just see that in this slide, in the 19th July, there is focal dysplasia is seen with evidence of fibrosis. And after treatment, you see this. You can just see that focal dysplasia is found in this report. Then the same report from All India Institute of Medical Science, Bhubaneswar, you can just see there is no evidence of any dysplasia, invasion, no fibrosis, etc. That says there is a good improvement and the dysplastic cells are reversed back to normal. Here the keynote prescription is calcium tellurium in ascending potency in centesimal scale, and the keynote was there is along with the common symptoms of leukoplakia, there is a garlic odor of the breath. This is the keynote for calcium tellurium. This is a case of submandibular adenoma, where you see there is a papillary pattern, elongated nuclei, some showing abnormal nuclei, some showing nuclear group, and this indicates there is some changes in the dysplastic changes in the cells, and you see the pathologist told that the possibility of papillary carcinoma cannot be ruled out. Then undergone treatment after 1 year. After 1 year, you see the smear shows a route to elongated nuclei arranged in papillary pattern, few showing nuclear group, and here biopsy is strongly suggested to differentiate metastatic papillary carcinoma or salivary neoplasm. This is after 2 years of treatment, you see smear shows clusters of benign salivary epithelial cells. There is no abnormal nuclei, no nuclei with nuclear group, having Hurtel cell change arranged in papillary pattern, and the impression is cytomorphology is suggestive of chronic cyanoadenitis with cystic degeneration. And in this case, you see this case is cured by constitutional prescription, a long treatment for 3 years. You see started in 2013 and cured in the year 2015. And you can well see that here the southern is BK Sahu and rest is mine refer. And here I have given a constitutional treatment, first bromium, then tuberculum, then solinum. An interesting case, we can see his history. And this is the third case, is a case of cervical interepithelial neoplasia grade 1. You can well see here, dysplastic changes is quite obvious, touching half thickened epithelium in some places. There is ulceration and moderately dysplastic cells within the epithelium CIN1. After treatment for 1 year, you see there is severe inflammatory changes seen. There is no dysplastic or malignant cells are absent. Here, this is a keynote prescription. Here, Candida albicans is given. This is a very, very important case. A lady frustrated from his marriage, frustrated from his beloved, becomes like mad. So it means from suppressed emotion, dreams of brutality, dreams of bombs, mistakes in talking, unable to correlate the right word during the giving history to me. This suggested Candida albicans, which cured the case, which reversed back the dysplastic cells to normal cells. This is another case of endometrial hyperplasia. You can just see here the endometrial thickness is 18 here, and correspondingly in the same date, the CA125 is 153.25. This is also after 1 year of treatment. See, endometrial thickness is 8 and the CA125 is 9.7. This is also consistent prescribing of phosphorus, a long treatment followed by tuberculum, etc. My drugs, which I take the help of my drugs, phosphorus indicated in much more cases and given 67, where it is indicated 67% improvement. Calcarea carb indicated, like I see the percentage improvement, and in the keynote group, this is interesting. I have found certain good drugs acting as keynotes. For leukoplakia, Cornus sarcinatus is a very good drug, having tremendous burning pain, more than anthracinum, more than arsenic, more than Tarantula hispanica, and a very good drug, and also Callium tellurium, which I prescribed to my patient having garlic odor of beet. So submandibular adenoma, trifolium defense is a very good drug which helps me in many cases. Keynote, when there is a absence of considered prescription. Similarly, in the pre-cervical cancer state, that is CIN grade 1, Hirubin medicinalis and Histaminum myoticum are the drug of choice, help in many cases. In endometrial hyperplasia, albicans, Hirubium medicinalis, Fuligo, Lapisal, Ostilago are the drug of choice, helping in reversing the hyperplasia stage to normal. In glioma, in acute stage, there is apomorphine hydrochloride, Conium silicea are very much helpful. And in schwannoma, Tarantula hispanica, particularly there is a single medicine in the repertory, tumor in spinal cord. Only one drug, that is Tarantula, and if you apply Tarantula to tumor in spinal cord, maybe neurofibroma, maybe any schwannoma, could be anything, it helps a lot. So, as we all know, constitution with the hereditary latent magnetic state, when exposed to persistent cause, deranges vital force, producing reversible pathological state, without any signs and symptoms, known as the pre-pathological or dynamic pathological state. I'm again repeating, constitution with a hereditary latent magnetic state, when exposed to a persistent cause, deranges vital force, producing a reversible pre-pathological state without any pathological manifestation of signs and symptoms, dynamic or pre-pathological state. And in this dynamic or pre-pathological state, you see in conventional medicine, no pathological signs, no diagnosis, no treatment is available. So disease progress to pathological state, and if removed, suppression of psychotic miasm leads to malignancy. But in homeopathy, without pathological signs, homeopathy can be prescribed based on miasmatic and constitutional symptoms, which reverse back pre-pathological condition to a normal state. So homeopathy is found to be effective both by constitutional and keynote prescribing, where the dysplastic cells reverse back to normal as statistically evaluated in the study. Although keynote basis is less effective. This is very important. Causation, miasmatic state, hidden facts of genetic mapping responsible for production of tumor, which are given least importance by allopathic doctors. And these states are taken care by homeopathy, thus helps in reversing the pre-malignant tumors to normal pathology. And lastly, few symptoms of the keynote medicines. I have told you, Callium tellurium is a medicine for leukoplakia, and the keynote is garlic odor of the breath with salivation, swollen and white patch ulcers of the tongue. Calichlor, another good medicine for leukoplakia. Profuse secretion of acid saliva. The keynote is mucous membrane is Tumid with gray-based ulcer. Tongue swollen, after these are all common conditions, but the keynote here is gray-based ulcer. Corner sarcinitis, I have told you, tremendous burning of leukoplakia, more than anthracynum, more than tarantula, more than arsenic. Such a case, when there is other common symptoms, ulceration of tongue, gums, mouth, throat, and stomach is there, then you can think of Corner's sarcinitis. Mercurius cyanitis, halitosis, ulcers with gray membrane, and tarasketum is another very dependable drug for leukoplakia, where the entire tongue is covered with white film, feels rough, comes up in patches, leaving red sensitive spots and with bitter taste and irritation. For cervical intraepithelial neoplasia or a CIN, Oromir nat is a good drug where there is a on PV you will see indurated cervix with a complaints of burning, stitchings in pain with induration. Candida albicans, I have told you, dependable drug where elements from suppressed immersion, which a case I have cured a girl, say 30 years lady being frustrated in marriage, undergone second marriage, and they are frustrated, becomes brutal, becomes very bad, rough behavior. And when the lady came to me with the CIN1, she suffered from dreams of brutality, dreams of bumps, mistakes in talking like a semi-mad person. Hirubin medicinalis is a good drug for pre-cancerous cervix, where there is a brown licoria before menses. And Hirubin medicinalis is a pre-cancerous drug for menopausal ladies like Sorinum, like Sanguinaria canadensis, where there is a leukorrhea in menopausal ladies. The histaminum videoticum is also good for CIN, where there is hardworking, ameliorates the mental restlessness, wandering ameliorates the mental restlessness, elements from bad news, and dreams of animals. Last slide. Some keynote symptoms of endometrial hyperplasia, ligni, when there is a chronic irritation. Nowadays, a lot of things are kept in uterus for, say, family planning, for some menopausal bleeding, etc. So, when there is a chronic irritation of mucous membrane with the thickening of endometrium, with hemorrhage in cancer, and those patients are so depressed they become maximum sad, more than having a tremendous thought of suicide. Glioma, for glioma, apocyinum hydrochloride is a very, very good drug for acute case. When there is a violent inclination to vomit, vomiting preceded by nausea, lassitude, increased sweat, increased saliva, increased tears, vertigo, dilated pupils, feels hot all over the body, especially in head.
Hey, doctor, we really sorry to interrupt you, but the time is up, and I request you to kindly conclude.
Last
that.
slide. Oh,
Yes.
yes, only 1 second, madam. So, apocyinum hydrochloride is a very good drug for acute stage of brain tumors, glioma with this type of symptoms. Naphthoquine is to arrest rapid development of glioma, and plumbum iodatum is a drug for the gradual development of paralysis due to gradual development of glioma. Schwannoma, tarantula histomica, tumor spinal cord. Thanks, madam. Thanks to the participants for a patient listen, hearing, and giving some little more time. Thanking you.
Thank you, Dr. Nanda. I would first request Dr. Sethi to please share your comments on the presentation. Dr. Sethi, are you able to hear?
Sir, I think she is not able to hear us, so we may proceed.
I would request Professor Michel Frass, if he's is there in the participant. Okay, I think he's not here. Okay, so
I think we'll call the next speaker meanwhile.
Yes, yes, yes. And I would again request all the speakers to please restrict your presentation within the prescribed time limit. Dr. Rekha, please, I would.
Yeah. Yeah, I would like to invite the second speaker for the session. We have Professor Prashant Rath. He's Professor, National Institute of Homeopathy, Kolkata, India. He'll be presenting a case report on saving lifelong disability in a post-operative case of adenoid cystic carcinoma of left palate treated with homeopathy. Welcome, Dr. Rath. You may please start your presentation.
Are you able to see my slides?
Yes, sir, we can see. Can you please enlarge it?
Okay, I'll do that. And your respected chair, co-speakers, moderators, and people who have joined this webinar, teachers, students, researchers, and friends of homeopathy. I uh, really greet all of you to this webinar, and thank you for the organizers for giving me this opportunity to present my presentation. This is saving lifelong disability in a post-operative case of adenoid cystic carcinoma of left palate treated with homeopathy. Uh, as you all know that adenoid cystic carcinoma is a rare tumor constitutes for less than 1% of head and neck malignancies and 10% of all salivary gland tumors. Palate is the most common site to be involved in the oral cavity, and they are usually asymptomatic, very slow growing, characteristically shows infiltrative growth and perineural invasion. This is very, very important as this tumor grows and it can spread through the nerves and it can reach to the brain because of proximity. So it has got these characteristics. And the standard treatment of surgery and post-operative radiotherapy has remained the standard care for past 3 decades. Little progress has been made in advancing curative treatment of adenoid cystic carcinoma of head and neck. The disease is said to have fatal outcome. And with this background, I am going to present the patient's details. I am showing the patient's name also because he has given me consent for no like for name and all identities. So that is why I don't hesitate in sharing his name. And he was a Muslim male of 69 years, and he was working usually in a jute mill. And after that was closed, he is now running a shop. He was presenting with a whitish plaque-like covering over the ulcers and the roof of the mouth. No pain, no bleeding since 1.5 months. While eating the food used to stick to the roof of the mouth where it is ulcerated. The patient has no trouble in, otherwise he does not have any problem in eating. No burning, no pain, and there was leukoplakia-like appearances over the ulcer. And there was weakness and difficulty in breathing on going upstairs. These were the presenting complaints. And going back to the history of the presenting complaints, the present complaint started 15 months ago with a small swelling in the roof of the mouth on the left side. And it was slight bleeding for which he consulted homeopathic physician. Later on, the swelling increased in size and he was advised by the homeopath to to an allopathic hospital, go to an allopathic hospital and get the consultation. And then he went there, and after that no he was diagnosed with the disease condition. They suspected it because he didn't do no, like FNAC or biopsy before doing the surgery. So he was advised surgery for the same, and he underwent surgery on 4th May 2021 on the hard palate of left side under general anesthesia, and he was discharged on the very next day. And this is the picture of the patient. You can see there is an ulcer inside the mouth, okay, and there are white patches also is visible. There is no bleeding, and there is no other discharge from the site also. Then coming back to an examination, only that ulceration part. Other things are less relevant. I'm not going into the details of those things. They're very much normal. And the regional lymph nodes were not enlarged. Okay, so because we all know that when dealing with a cancer patient, we need to find out the TNM classification, where we need to find out whether the regional lymph nodes are enlarged or not, and whether it has spread to other organs or not. Then there are other investigations also. Like before doing the surgery, they found that the patient hemoglobin percentage was very, very less. As you can see from the slides, it was 5.9. So they know this. First time here when they investigated the patient, it was around 15th of March, and these are the findings. Sodium and potassium are less, and no serology, all HIV, hepatitis B, hepatitis C, because no we have to differentiate from all these disease conditions. So these were all negative. That is why they waited for another 15 days and asked the patient to do the investigations again from another laboratory, and they could found that the hemoglobin percentage improved, and no like and the sodium potassium, when it improved, then only they did the surgery on 4th uh, 4th May. And when all these investigations like were within the normal range, then they went for the surgery. And if you can see this slide, uh, excision of hard palate mass under general anesthesia, and it was done the 4th May 2021. So after that, they sent the mass for histopathological examination. Just a minute. You can see very well. The features are compatible with adenoid cystic carcinoma. Adequacy of surgical excision cannot be commented upon, as the tissue received is in fragments and not as an intact one. This is very, very important, because no like they could not say that no they have removed the entire mass. So that is why this point is very valid point here. So he was diagnosed with adenoid cystic carcinoma, and he was discharged the very next day. On the follow-up visit on around 24th, no like he was, they found that the ulcer is not healing, and they again recommended him total maxillectomy and facial reconstruction under general anesthesia. I am not showing the previous slide where no like he have been examined by a professor of an ENT and two other doctors. He has been under the treatment of three physicians. So they have examined during the follow up, and they have taken a decision that the patient has to undergo total maxillectomy and facial reconstruction under general anesthesia. And he had no other family history. His brother died due to some liver complaints, which he could not elaborate. Personal history: he was taking pan with betel nuts. Occupation: I have already told, he was working in a jute mill. After that was closed, he after he started his own shop. So this is the advice he was given. The plan of treatment for the patient was again the same group of doctors. They have examined him, and sorry. So the patient, see, he was advised total maxillectomy with reconstruction, facial reconstruction under general anesthesia. But the patient refused for surgery. If you can see, the OT was not done as the patient refused for surgery. I have a video of the patient because he has been healed with our treatment. So he was not reluctant to give his identity. He was telling, I can, even if you call, I can come over here, because it's already too late. So so that is why I took a video of the patient, and I will be sharing the video with in this platform. So From homeopathic perspective, if you see, like the appetite was good, he had an aversion for warm food, and he has a aversion for sour food also. Intolerance for prawns because it was causing him some skin problems. He was allergic to prawns. Then nothing important from this point of view. Then mental journals, if you see, he was always telling why God has given me such a fate. I am suffering from this dreaded disease. So he used to get angry easily and shout. He told one incident that he had a fight with some of his colleagues, and he beat that person and he was bleeding from the nose. And after that, he felt very bad, and that day onwards, he decided that I will not, I will not mess with anybody else now onwards, and let God forgive me for the incidents like that he was telling. So that was the state, and then he was, when he was advised this operation, he was not ready to live with such kind of facial maxillectomy, and he denied the treatment, and he thinks that it is better to die than live with half of his face cut, and he came to our treatment. The basis of selection of remedy is a non-healing ulcer, recurrent of malignancy, or he was heart patient, left-sided complaints, aversion to warm food, aversion to sour, loquacious, and religious. These were the rubrics we have taken, the same symptoms converted into rubrics, and as you can see, the medicine is lachesis, 16 by 6, lycopodium 13 by 7, and netremur 10 by 7, nox vomica 9 by 7. The patient was given lachesis. Along with that, we have given, no, this is a prescription. Uh, I will show you, this is the first prescription, what we have given. This is lachesis 0 by 1, along with calcarea sulf 6x. Okay, alternatively, we have given here. This is the first month. This is the second month. You can see the picture. Still, the ulcer was there as it is. No, we don't make any mistake while making the first prescription. And no, like if the patient is not improving, we lose our patience and we change the medicine. There lies actually crux. In practicing homeopathy, you have to be very very patient, and especially when you are dealing with cancerous cases. The second month he was not improving. You will be astonished to see in the third month there was no ulcer. So we stopped calcarea salt, and we continued with lachesis 0 by 3 because he had some kind of swelling, and there was little bit of pain. That is why lachesis 0 by 3 was continued. So, and till now we are taking the, then you see we have stopped lachesis also. We have given placebo, and only placebo. He is on only on placebo. Okay. So till the last follow-up, you can see he has been, for last 3 months he has been given placebo, and he is improved. And from the present perspective, if the patient was taking only homeopathic medicines, not even applied any other local application, and adhered to the medication without fail, and was willing to come for follow-up anytime he would be called for. No adverse effects reported. Patient is hale and hearty. I would like to say, no, I don't take any credit for this. Whatever has been done, it is because of homeopathy. So let us listen from our patient.
यासीन शेख जी। अच्छा, आप किस लिए यहाँ पे आए थे? कब आए थे यहाँ पे? पहले कब आए? पहले हम चार 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 महीना हो रहा है। 4 महीना हो रहा है। हाँ, जून महीने से आए थे फर्स्ट। हाँ, है ना? क्या हुआ था आपको तकलीफ? क्या था प्रॉब्लम? वो हमारा ट्यूब में ट्यूब ऐसा हुआ था और दर्द कर रहा था, तो हम पीजी में दिखाया था। पीजी ने ऑपरेशन कर दिया। कर लेने के बाद तो फिर हमको क्या, तो हमको बोला कि लेकिन और ऑपरेशन आपको करना होगा, इसलिए आपको टिकट आओ। तो हम लोग करने का दिल नहीं था। हम बोले कि साहब हम करिए कि हम लोग का अच्छा हो जाए, हम लोग ऑपरेशन नहीं कराते, बोले थे ऑपरेशन कराए, क्या ऑपरेशन कराने के लिए बोल रहा है, नहीं बोल रहा था आप ऑपरेशन करने के लिए। अच्छा, उधर की सर जो है आपको कैंसर हो गया है, आपको ये आधा ऑपरेशन करके हम लोग निकालते हैं। अच्छा, हाँ, तो हम लोग बोले एक दफे हम लोग ऑपरेशन करके दूसरा दफा हम लोग ऑपरेशन नहीं कराएंगे। अच्छा, तो लड़का हमारा बोला कि नहीं हम पापा जी को ऑपरेशन नहीं कराएंगे, हम लोग का साथ अब वो जो है जीते जीते अपना वक्त आगे पीछे वक्त बैठा देगा, जो होगा। तो यहाँ कैसे आए? यहाँ हम लोग से मोबाइल से हम लोग पुलिस की निकाल देंगे हॉस्पिटल। अच्छा, पुलिस की निकाल कर और मोबाइल जाकर बोले कि आप नहीं जाइए, वहाँ आपका ठीक हो जाएगा। अच्छा, तो हम लोग मोबाइल देखे कि हम लोग यहाँ पर आए आपके पास। अच्छा, आके बोले ऐसा बात है, हम लोग और
Dr. Rat, with all due respect, actually the time is up, so could we please request you to conclude in next 30 seconds, please?
Okay.
Yeah, we have already overshot the time, so we have other speakers lined up.
Actually, I
Thank
got
you.
less time.
अच्छा, कितना महीना ट्रीटमेंट हुआ आपका? लेकिन 3-4 महीना हो गया।
Give me 2 minutes, madam. It will be finished. I have already finished my presentation.
चौथा कितने बार आए थे यहाँ पे? ये लेकिन 7 दफा होगा, 4 दफा। और इसको छोड़ के और कोई दवाई खाए थे? नहीं, आप सिर्फ आपने दवा खाए है, बस आपको ये वही दवा खाए, कोई दूसरा दवा नहीं खाया। कोई दूसरा नहीं, कुछ लगाए थे वहाँ पे? नहीं, कुछ नहीं लगा, कुछ नहीं। अभी आपको कोई प्रॉब्लम नहीं है? कोई प्रॉब्लम नहीं है, और यहाँ से किसी का खुला हुआ है, कोई उनको तकलीफ होता है कभी, मतलब खुला सेंशन करता है। और वैसे खाओ वगैरह कुछ नहीं खाओ, अभी खाना पीना सब ठीक, सब खाते हैं, पूजा सब खाने पीने का कोई तकलीफ नहीं है। पूजा भी खा लेते हैं, कुछ भी खा लेते हैं, मूर्ति का खा लेते हैं, आप रोटी भी खा लेते हैं, खाने में कोई तकलीफ नहीं है।
Dr. Rath, could we please request you to sum it up and give a summary of the video, if that is perfectly fine? We have other speakers also, and we have other sessions lined up. Thank
I
you.
got less time, madam. I was just get the videos over. I have already finished my presentation.
Okay.
Just I will conclude within one line. I don't have much time.
कितना टाइम लगता है? हम लोग को बाइक में 1.5 घंटा करीब लगता है। बाइक में 1.5 घंटा लगता है। सीधा आते हैं किसी से होके पीछे होके सीधा पुल के ऊपर से डायरेक्ट, फिर इसके बाद पीछे जाएंगे आप बताने के लिए उनको कि आप सही हो गए। किसको बताएं, वही सोच रहे कि अपने को खराब लगता है ना, लोग कोई कुछ बड़ा ऑफिसर है हम लोग जाके क्या बोलेंगे, अपने को खराब लगता है। ऐसे हम नीचे का जो आप बोल रहे थे कि आपका एडमिशन हो गया था ऑपरेशन के लिए, वहाँ पे ऑपरेशन के लिए एडमिशन कर दिया था हमको, एडमिशन किए, रात को हम लोग का वही प्लान था, हम लोग ऑपरेशन नहीं कराया, वो बोल दिया कि आपका अपना जान का गोश्त मांसो काट के यहाँ बैठाएगा। अच्छा, पैर का हड्डी काट के यहाँ बैठाएगा। अच्छा, ऐसा बोल दिया, हम डर गए, हम बेकार हो जा रहा है, लड़का बोलेगा काम करें, हम छुट्टी करा के, लड़का बोले नहीं आप बात चलिए, जो होगा सुख हम साथ में बात। तो जाके लड़का रिसर्च करके आपका हॉस्पिटल का
Cool, this is done then. This is done.
Okay, so I have already finished. What I have to show, I have already shown. The patient was describing the same thing. So homeopathy could save this patient from lifelong disability due to surgical intervention in malignancy, and we can have a better alternative for such cases. So we usually get afraid to deal with such cases. What I have tried to show you is like we have scope in homeopathy in dealing with such cases. Only thing is the patient has to come at an earlier stage, and they have to have belief on our system. And these are the reference. This is the patient consent form. And just I will tell one thing, that we usually think that only one medicine may be enough to treat disease conditions, but no, like if you go through Burnett, you will find what he says is, like if you want to grow potatoes in a field consisting of one chemical field consisting of only one chemical element instead of ordinary humus, or leave a hope of somebody being able to win a long and very difficult game of chess by making one move by itself, it is very difficult. So we have used whatever we have used, that we have shown it honestly, and the patient has improved. That is what I wanted to share on this platform. Thank you very much for giving me the opportunity.
Thank you, Professor Rath. That was a wonderful evidence-based case report showing efficacy of homeopathy. Now the floor is open for question and answers. I would like to request our chair, Dr. Sethi. Ma'am, any questions?
Dr. Rath, you have really touched the topic so well. But what I have to say is, for the patient point of view, it is great, and we can even the Dr. Nanda's presentation was great from the patient's point of view. But like, I would request to put some light from the practitioner's point of view, like how your knowledge can help others to follow it and give relief to many people. Now it is limited to what you have treated, what Dr. Nanda has treated. But ultimately, the cancer is getting rampant with urbanization. This is a curse of urbanization or a rampant growth. We have no control on that, but yes. Some suggestion I would like to add at the moment, and I will continue with other sessions also, that after this colloquium also we stay connected and form a sort of a society where people who are mainly dealing with cancer cases can join hands and spread knowledge to masses, so that allopathic has very limited role. It has only palliative role, that's all. But even in palliation, at times the quality of life is deteriorated so much that life is not worth living. Whereas homeopathy has preventive, curative, palliative, along with better quality of life. So I think as our this session goes on, we will be learning more and more. But at the end, we'll all like to join hands. And Dr. Rekha, you can now call the next speaker.
Thank you, ma'am. Yes, joining hands together, we all can move forward. Yes, Dr. Mohit, please.
Okay, so thank you, ma'am. So our next speaker is Dr. George Matthews. Dr. George Matthews is Reader NFSG in Department of Materia Medica in Nehru Homeopathic Medical College and Hospital. He is going to present a case report on neuroblastoma. So over to Dr. George.
Tomorrow 10. Yeah, tomorrow 10.
I hope my screen is visible and I'm audible.
Yes, perfect. Please proceed.
Yes, visible.
So today I'll be presenting a case of neuroblastoma stage 4 with multiple hepatic metastasis in a 5-month-old infant, and its complete remission through homeopathic treatment. So my co-authors are Venita Susan Jacob, Dr. Saifuddin A, who is a treating physician, and Dr. James Michael. So something as an introduction to neuroblastoma, it's an embryonal tumor of the which generally occurs in very young children. And this cancer is the most common malignancy in infants and the most common extracranial solid tumor in children. So as you can see, it covers almost 7 to 10% of the pediatric neoplasms and 50% of the malignancies diagnosed in infancy. And the main sites are adrenal gland and the mediastinum. The most important thing to remember in this neuroblastoma is the highly variable clinical presentation, which can range from a asymptomatic mass to a primary tumor with a widely disseminated disease. So before going to the case proper, I will be touching upon the prognosis. So here you can see that approximately 700 children are diagnosed each year in the USA, representing 8% of all pediatric cancers, and disproportionately accounting for 15% of childhood cancer deaths. So over a period of time, the overall survival has improved, but even then, 36% of patients present with metastatic high-risk disease that is difficult to cure. So for such patients, overall survival rates remain below 40%, despite multimodal therapy, including myeloablative, chemotherapy, radiotherapy, immunotherapy, and aggressive surgery. So important thing to remember here is again, the overall survival is poor in high-risk cases. So only you can say 34% overall survival. So this is a statistics of the taken from the Adayar Cancer Center in Chennai. So where they have seen that 4 out of 19, that is only 21% are alive and in remission post autologous stem cell transplantation. Now we come to the case proper. So this case, before I start the case, I will say this is a case very close to my heart. And the reason for that I'll tell at the end of my presentation. So this is a 5-month-old infant presenting with a lump in the abdomen. So diagnosed as a neuroblastoma stage 4 case with multiple metastatic deposits in the liver and involvement of the contralateral para-aortic lymph nodes. Although chemotherapy was followed by surgical resection, this was suggested by the pediatric oncologist who saw the child at the regional cancer center. But after assessing the possible risks and all the side effects, the guardians opted for homeopathy. So in a child, in an infant, most important part of case taking is the family history along with the observation of the child. So the family history, you can see that I've tried to highlight certain things in red color about the father, the paternal grandfather, the paternal grandmother, mother, maternal grandfather, maternal grandmother. So this highlighted portions you can go through, you can see repeated childhood asthma, a benign hypertrophy of the prostate, warts on abdomen, dermatosis papilosa nigra, excessive hair growth on the body, seborrheic keratosis, BHP, warts, excessive hair growth on the body, and renal calculi. So all these very cumulatively add up to the predominantly psychotic history in the family. Then we come to the therapeutic intervention. So as I told above earlier, the easily startled, or the observation is most important here. So we can see the child was easily startled and woke up from the deep sleep. Actually, he was brought to the treating physician at around 11 p.m. at night. So he was in deep sleep, and when the ring of a phone call coming to the physician, he woke up and started crying. This was noted by the physician. So this symptom you can see reflected in Allen's keynotes, in Clark's dictionary, in Kent's Materia Medica textbook, in Comparative Materia Medica by Candigabe, in Materia Medica of Homeopathic Medicine by Fatak. So that in different words to understand this easily startled sensitivity of the patient. The second thing which was observed in this infant was the extremely hot thermal reaction. So whenever he went to sleep or he wanted the fan at full speed, and if the fan was put off or switched off, he would immediately start crying and get up from his sleep and remove all the covering always. So you can again see this symptom reflected in Allen's keynotes, in Fatak's Materia Medica, in Clark's dictionary, and in Kent. That means wants to be fanned all the time, throws off the clothes. So that is 2 observations of the child. The third one was the physical journal, important symptoms of desire for sour, salt, sweet, and ice cream. So this child, 5-month-old child, like he was trying to be weaned off. You can see that these symptoms, these things were very much prominent in his diet. Whenever he wanted to have these things in his diet, when it was started to change over into the solid food. So you can see this reflected in Clark's dictionary, in Grimmer's books, in Allen's keynote, and in Fatak. So sweets, sour things, oranges, ices, etc. Then we come to another, again, physical journal, very prominent, excessive thirst and hunger. So the child used to get up in the middle of the night, crying, hungry and thirsty. So he would have to be given something, and then only he would go to sleep. So this is very prominently seen in the child. And again, you can see these 2 important physical journals being reflected in Allen's keynote, in Clark's dictionary, and in Kent's textbook of Materia Medica: ravenous hunger, unquenchable thirst. Then this sleep position, always wants to lie on the abdomen. And you can see this reflected in synthesis repertory as a 3-mark remedy, which I have selected, coming to that, and better lying on the abdomen, which is seen in Fatak's Materia Medica. And then these 2 things, again, coming to the family history and the history of psychosis. You can see this in Allen's keynote, where it is given serous carcinoma or cancer, either acute or chronic, when the symptoms correspond, and history of psychosis. So this is a very, very strong point in the case. You can see the history of psychosis in the family. And again, in Fatak's Materia Medica also, you can see the tumors cancer cirrhosis with a history of psychosis. So why I am telling all this materia medica references is that the remedy which I have given or was given in this case is a remedy which never comes up normally on repetrization. So you can see meteranum 0/3 was given, started in April 2nd, 2002, TDS. And after individualized homeopathic treatment for a year, you can see the size of the hepatic metastatic deposits started decreasing, and followed by complete disappearance of all deposits and decrease in the size of the primary tumor. To the time frame of the treatment. So you can see in 30th January 2002, the first CT scan was done in Regional Cancer Center Trivandrum. The neuroblastoma measuring 6.9 into 6.7 into 5 centimeters, and multiple calcifications are noted in the upper para-aortic region. So this is an important finding which goes in favor of the neuroblastoma stage 4. So if the contralateral the para-aortic lymph nodes are involved, it is definitely a stage 4 and not a stage S, which can go for a spontaneous regression. So this is very important finding in the diagnosis of the case and the stage of the disease. An FNAC was done, which showed a malignant round cell neoplasm, possibly neuroblastoma. Then we go to 3 months after. So in April 16, 2002 itself, you can see the ultrasound scan abdomen, which showed mild hepatomegaly with multiple hypoechoic areas of showing the metastatic areas. And the left suprarenal mass shows a mixed echogenic mass of 81 to 66 millimeters. So this was an increase, you can see. This is when we started the treatment. So after starting the treatment, you can see the next date, that is April 4, 2003. So this is almost a year after. You can see the neuroblastoma size has come down to 7 centimeter with liver metastasis. Still it is there, but there are no enlarged para-aortic lymph nodes. So there is almost a year of meteranum 0/3. It's very interesting to see the same medicine over a year with no change in symptoms, but you can see now he can see the size reduction. And then another year down, you can see that is 2004. You can see the 4th June 2004. You can see the ultrasound. There you can see exactly the changes starting to come in. You can see the resolution of the hepatic metastatic deposits and a marked diminution in the adrenal mass. So the metastatic deposits completely dissolved or disappeared, and there was a size reduction, 2.1 into 2.7 centimeter size from the earlier 7 centimeter. And then one more year down, 31/5/2005, you can see well-defined mixed echogenic mass. So here you can see a slight change. So earlier it was 2.1 a year before into 2.7. Now you can see 35 into 43 mm. That means almost there's a significant increase. So there's an increase in the size of the lesion here. So this is where the medicine had to be rethought of and changed actually. And the last slide at the end of the timeline, you can see this in May 2006, 20th May 2006, there's no evident abnormality. That means the complete resolution of metastasis and the primary mass. This is the timeline of the case. Now, I'm just going into the detail of that. That is, after 2 years, this tumor started slightly increasing in size. That is when we thought of, and new symptoms actually, that is why we thought of increase or changing the remedy. New symptoms appeared. So the prescription was changed again to, so that means always the child is now 4 years old and the symptoms, thermal reaction still hot, but few symptoms added. One is marked hyperactivity, very importantly noticed, and restlessness. The way the teachers used to say that the child could not sit in the class, and fastidious about his possessions. This is very important as reflected in synthesis repertory. So he never urinated in bed. So you can see in children, they normally urinate in bed, or that's a normal thing. So he used to go outside and then urinate outside the mosquito net and came back to the bed and lie down. So that is what he used to do. And here you can see arsenicum iodatum under restlessness. So this is a reference by George Vidolkis, Mitra Medica Viva. This is one of the most restless remedies in the Mitra Medica, and it produces a physical and mental restlessness that can be described as physical unrest. The body cannot find rest. It is actually, he says that it is a combination of the restlessness of arsenic and iodine. So that cannot be a worse restlessness. So normally we say aconite, Prostox, and arsenicum, but here is the remedy which has to be highlighted for a high degree, much higher degree of restlessness, combining the restlessness of arsenic and iodine. So here you can see a reflection of that in Gaskin's comparative study of Kent's Medica, and in synthesis repertory, it's a 3-mark symptom in restlessness and in hyperactive children. So these symptoms, hyperactivity, restlessness, and fastidiousness, went in favor of arsenic iodide, and then we started him on arsenic iodide. The outcome. So we come to 2006 when the primary tumor, which was started increasing, completely resolved after arsenicum iodatum 0/3. Now we come to the last, this is the last report which I showed. So here you can see highlighted, no obvious para-aortic lymphadenopathy or ascites seen, and no evident abnormality detected. So this is the last finding of the child showing complete recovery. And I come to the homeopathic inference part, the most important inference you draw from the case. So 2 things I noticed in this case. One is the case exactly followed the Herring's law of cure in the direction of cure. You can see the size of the multiple hepatic metastasis. There were actually 4 metastases in the liver. The largest one was almost 4 centimeter size. So firstly, the larger metastasis disappeared, decreased in size, and then followed by the smaller ones, and the whole 4 metastatic lesions disappeared. So the first, all the metastatic lesions disappeared, and then you could see the complete disappearance, and then followed by the complete resolution of the primary tumor during the course of the treatment. The second thing is the aphorism 36 in Hahnemann's Organon of Medicine, which is observed true throughout the period of this treatment of the case. That is, if 2 dissimilar diseases meeting together in the human being be of equal strength, or still more if the older one be the stronger, the new disease will be repelled by the old one from the body and not allowed to affect it. So here the child, like 5 months old child, developed neuroblastoma, and during the whole period of 4 years of treatment, you could see that no other infection. So in a child, you normally come across upper respiratory infections, diarrhea, fever, recurrent attacks of fever. All these things are very common in children, but none of these happened. That was something very unique in this case, and led me to think of aphorism 36 being confirmed in this case. So these 2 things were the homeopathic inferences.
Dr. Matthew? Yeah,
Yes.
okay, yeah. Your concluding slide.
Conclusion, that is, normally in the conventional system, you have chemotherapy, radiation, surgical resection, or a combination of these, which are employed for neuroblastoma patients with life-threatening hepatic involvement. But in this case, if you see, you can see that complete remission was achieved using only homeopathic intervention. And this suggested a scope for use of the therapy in such cases without the harmful risks associated with other conventional methods. And this is the child now as a grown young man. He's 20 years of age. So this is a 20-year-old follow-up. So normally in a cancer case, you have normally think of a 5-year survival. This is a 20-year-old follow-up. And the reason why I told you this case is very, very close to my heart is this is my son himself. So this is my experience seeing the case, seeing the developments in this case. So I thought I should definitely share this case with you. Thank you. This is the bibliography for the finding. I have tried to follow the Van Hesseling's homeopathic home case care guidelines for presenting the case. Thank you.
Thank you, Dr. George. It was indeed a very good presentation. And now I would request Dr. Sethi to please comment on the presentation.
Dr. Matthew, congratulations that you could do so much, because like I'm getting a little emotional on this, knowing he's your son, and you have, I mean, it's very tough to elicit such finer details in a small child. Actually, that would have been my question to you, but since he's your own son, I cannot ask this because you are observing him day in and day out. I have personally witnessed a case of neuroblastoma. The child was 2 years with roaming around wherever they could do. They must have spent some 40-50 lakhs of rupees, and still they could not save the child in spite of giving the best treatment. So my compliments to you for this case. And arsenic iode, I will like to give my input. Like restless remedies, you said arsenic, rustox, and aconite. But in such cases, we need something which touches the organ, which touches the pathology. For that, ars iode definitely fits better. Moreover, it suited the other symptoms also. So once again, my compliments to you.
Thank you, ma'am. I would just like to add one point only. That is, in this case, actually, when we came to the pediatric oncologist for treatment in RCC, she said that even after chemotherapy, you get maximum of a year to live. So that is, being a homeopathic doctor, I know very clearly, because I've seen a lot of patients of leukemia and all going for chemotherapy, and then they just wilt away. I've seen a lot of patients being. So I thought like I would make a decision, and I went to this Dr. Saifuddin, who is in Trivandrum. He is very senior department of. And the very interesting part is that every time we did an ultrasound, we used to send the ultrasound report to the pediatric oncologist, and she used to like acknowledge it. And after the treatment was over, she used to refer her cases to Dr. Saifuddin. So it is a very positive backing.
I totally agree. I myself have witnessed a case of neuroblastoma of 2 years, not even just 1.5 years before that child was no more. Parents must have spent 40-50 lakhs, and they had given their best, whatever was available. Still, the child could not be saved. So my compliments to you on your observation, on your patience and persistence, and to homeopathy, of course.
Thank you. Definitely, ma'am. Thank you.
Thank you, ma'am. Thank you, Dr. George. Now I would like to call upon the next speaker. We have Dr. Nitika Parikh. She's serving as consultant physician and director of Parikh Hospital. She'll be speaking on the role of homeopathy in the management of uterine leiomyoma. Welcome, Dr. Nitika.
So today we'll be talking about the role of homeopathy in the management of uterine leiomyomas. So if you see at the incidence rate, so leiomyomas are not only the commonest benign tumor of the uterus, but these are the most commonest benign solid tumors in females. As estimated, as study says, these are 70% of women by the age of 50 will get leiomyoma, which is quite a big percentage, out of which 30% of women, they suffer from a variety of symptoms. As leiomyomas are the growths which are made up of smooth muscle and connective tissues from the walls of the uterus, so they do not have a significant malignant potential. But when they cause symptoms, they are quite troublesome in the woman. Many women, they are symptomless. They do not possess any symptoms, but when they do, they are worrisome. And that's the main cause for the hysterectomy in them. So we'll see the common symptoms, which is abnormal uterine bleeding, that is the bleeding lasting for more than a week, or heavy bleeding. There is a pelvic pressure or the pressure in the lower abdominal area, painful coitus, and difficulty in voiding the urine. Also infertility. So let's have a look at a case. So on 1st of September 2017, a 45-year-old lady came to us in the OPD with the uterine bleeding and the pelvic pain, and she was suffering since 4 months. While going through the so many conventional treatment, and she did not respond there. While going through her radiological screening, There were 2 large myomas, one each in the anterior and posterior wall. As you can see in the report, one in the anterior wall, which is about 40 by 30 mm, and in the posterior wall, that is about 33 by 31 mm in size. So on 1st of September, the day she came, considering her present symptoms and the large size of the fibroids, she was advised surgery. But being this word surgery is such a, it's a worrisome word for a woman to go through. She was unwilling to go for the surgical intervention and she opted for the homeopathic treatment. So the day itself, working on her mentals, what we found out that this lady was so overworked, so frustrated, as she was holding so much responsibility. She had to do so much of house chores. So she had developed indifference, not towards her own affairs, but towards her family members as well. Because of the sufferings which she was dealing with, she was so depressed, weeping in anger, and as her husband was so busy in his work, they rarely used to spend time together, which also made her to be indifferent towards her. She was irritable, weeps easily. While going through her physicals, if you get a chilly, if you ask a patient about the thermals, so if you get a thermals in a good way, so you'll get a good totality. This lady was chilly. Every time while having a meal, she desires to have pickles. The clear-cut symptom was the melanosis, that the yellowish pigmentation around the nose, forehead, and around the lips. Particulars, there were abnormal uterine bleeding. On exertion for the stool, there was blood spotting, pelvic pressure on the little exertion. There was weak feeling in the lumbosacral region while standing for long or from sitting to standing, and she felt better with warm fomentation. So on repertorization, working on her mentals, CPR came out to be the medicine. So based on the device anamnesis and repertorization, CPR C200, a single dose was administered to her. From September 2021 to November 2021, we gave 4 doses of CPR C200 fortnightly, and there was the consistent symptomatic improvement was seen. On 17th November, when asked to go through a radiological screening, there was a complete resolution. You can see on 11/11/2017, there was a complete resolution of posterior uterine mass and a marked reduction in the anterior wall of uterus, that is 20.3 by 17 mm. So on 11th December 2017, again she came with a problem, with a symptom of dyspepsia. As she had told us, she had a very heavy meal that day and she is having a colic and indigestion problem. So we gave her Nux vomica 30 thrice daily. On follow-up on 15th December 2017, gastric symptoms were completely resolved. On 4th of January 2018, there were the recurrence of mental symptoms like sadness and irritability. So again, we gave CPR 1M, that too in a high dose, a single dose. On 1st of February 2018, the patient was completely symptom-free, asymptomatic, and further asked for the screening. So on 26th Feb 2018, uterus was free from all the myomas, both the myomas. So sepia, this remedy was first proved by Henneman, including 5 provers, and all of them were men. Again, reproved by the American Institute of Homeopathy under Dr. Carol Dunham, out of which 26 reports were submitted and 9 were women. And surprisingly, if you see, sepia is known to be a great woman remedy, although proved more on the men. T.F. Allen supervised 6 provings. So sepia, it has a marked action on the female sexual organs. So it is truly named as a uterine tonic. Also, it is often indicated in atonia of the organs. So also in the displacement of any kind, especially in the prolapsus uteri. So if we look at the theraps, like what other medicines can be thought of? For the fibroid, there is aurum urinatronatum. This we will discuss later on. Aurum iodata, calcarea fluor, calcarea iode, conium. See, calcarea fluor is a very good tissue remedy. It works well on the stony and hard lesions. Conium. This medicine is basically for the old maids and the women who are approaching menopause, who are at the climacteric. So in this, there is a uterine, because of the uterine affection, the lady has to go urgently for the urination. Fraxinus americana, which is a very good remedy. On the reports, you will see there is the uterus enlargement, also dysmenorrhea, and during the menstrual nisus, there will be a bearing down sensation with the abdominal pain. Sabina. The characteristic of sabina is during the menstrual period, there will be like a labor-like pains, and the pain will be from sacrum to the pubes. Cecal cord is also a very good remedy. In this, what happens? There is a continuous oozing of the bloody, watery blood till the next period, and there will be a hemorrhage on little exertion. Thalespi bursa pastoris. In this, what happens? During the menstrual period, there will be a problem, or there will be a flow of blood from rising. There will be a sore pain in the uterine region. Ustilago medis is also a good remedy for the flabby conditions of the uterus. So these are some remedies which we can think in fibroids. For bleeding, there are so many remedies, but I would like to tell you for ficus. Ficus religiosa is a very good anti-hemorrhagic medicine. This medicine can be thought of in case of hemorrhages where other medicines have failed. So this is a very good remedy. So these are
Doctor, I just request you to keep a check on time. We have last a few minutes for you to wind up. Thank you.
Okay, due to the paucity of time, second case I'll be briefing you. So second case, a 36-year-old female with an intramural fibroid came to us with the symptom of cervicitis, with the symptoms of leukorrhea, and the symptoms were resolved within 3 months, and the myomas were resolved within the 10 months. So this is the report. In this, there is the bulky uterus of 12-week size, and the lesion was of 15 to 24 mm. Intramural fibroid was there. So for this, what remedies we use on the basis of anamnesis? On the base, symptomatically, we prescribed first creosotum for the licoria discharge, and after that, thuja and auramur natronatum. As we were talking about auramur natronatum in fibroids also, so it's a clinical grand remedy for uterine tumors. As Burnett said, it has more power in uterine tumor. Uterus in this is ossified, enlarged and fills particularly the whole of pelvis. The cervix looks ulcerated, indurated, and the potencies which we used were D6 and C30. So the leiomyomas in these cases completely resolved with the individualized homeopathic treatment, and radiological imaging was frequently done at frequent intervals, and the patient were able to avoid unpleasant complications. And the first case was based on modified on the Naranja criteria score in case 1, which was 8, and in this one it was 7. So in conclusion, the results show that such cases have a very and potent non-invasive treatment option in homeopathy. These case reports are promising and indicate the need of a larger placebo control study. Thank you.
Thank you, Dr. Nitika. Now I would like to invite the chair. Ma'am, any questions? Dr. Sethi?
I think we have lost connection with Dr. Sethi. I'll check. I'll check with her. Meanwhile, you may proceed, ma'am.
Okay, then we are going to invite our next speaker, Dr. Alexander Fadi from Russia. Dr. Alexander is a private practitioner, and he is going to speak on possibilities of homeopathic method in improving the quality of life of patients undergoing anti-tumor treatment. So, Dr. Alexander, over to you, sir. Please present.
I'm here. Hello, dear colleagues. I'm very happy to be with you today. I want to thank all the organizers for this colloquium. Okay. We have already heard many interesting reports today on the use of homeopathy in oncology, and many of the authors talked about the need to establish a link between allopathy and homeopathy. Dr. Darius Pinedi and Dr. Alok Parikh talked about synergy and integration with conventional medicine. In fact, that is what my talk today will be about. As follows from a review posted in the British Journal of Pharmacology, nanopreparations are not yet available in medicine in their pure form. Nanotechnologies are used to develop biomarkers and delivery systems for pharmacological drugs. In general, the prospects of nanotechnology in medicine are still uncertain. However, homeopathy has long used methods that are close to nanotechnology in formal terms. Homeopathy appeared long before not only the formation of modern molecular biology, but also before the introduction of the mole concept proposed by Avogadro. Hahnemann suggests that the concentration he used were submolar. This circumstance makes some rational scientists skeptical of homeopathy. But it is what makes it possible to draw a formal analogy between homeopathy and nanotechnology. By the beginning of the 1990s, there were individual publications demonstrating the presence of biological activity in ultra-low doses and proving the sufficiency of modern experimental methods to study the effects of ultra-low doses. However, it was not until 1995 that a systematic in-depth study of ultra-low doses began for the first time in accordance with modern requirements for experimental and clinical pharmacology. The results obtained allowed the following views on the problem of ultra-low doses to be formed. First, ultra-low doses do indeed always have subtle molecular cellular effects. A number of authors in the 1918s described these effects and showed that their severity is extremely small. Therefore, ultra-low dose cannot be used in pharmacotherapy. Second, ultra-diluted solution are active due to a special potentiation technology proposed by Hahnemann, which has not yet found a rational physical explanation. Third, it has been found that a super small dose of any drug enhances its pharmacological action and simultaneously reduced the toxicity of the drug as well as the habituation to it. This phenomenon observed at the simultaneous administration of ultra-low homeopathic and regular allopathic dose was called bipathy. The phenomenon of bipathy has been proven experimentally in biological models. It has also been demonstrated that ultra-low dose influences or modifies the effects of the usual dose in simple physical and chemical reactions. This indicates that bipathy is not only a biological, but primarily a physical phenomenon. In addition, the phenomenon has also been studied in limited clinical trials in patients with alcoholism and drug addiction. The phenomenon of bipathy indicates that the effects of homeopathic doses cannot be due to the extremely small amount of the original substance contained in them. In a practical term, it is important that activated solutions can be used in pharmacology without reference to the theory. The activated form has new properties that the base drug doesn't have in the usual dose. There are several theories of water of memory that cannot explain the physical mechanism of the bipathy phenomenon. Activated bipathic forms in the substance always cause reproducible specific pharmacological effects, which allows them to be studied in and used within the traditional framework of evidence-based medicine. It's been proven on simple neurobiological models that the fundamental property of activated drugs in a sensitizing effect of the targets, which is strictly selective, specific in nature. Unfortunately, little is known about works in the field of bipathy with classical drugs. For example, in as early as 1996, extensive protective capabilities of ultra-low dose of prednisone with administered together with toxic dose of prednisone were revealed. A series of works was carried out with the classic pharmacological agent morphine. The effect of ultra-low dose of morphine is bipathic administration on neuronal activity, behavioral activity, pain sensitivity, metabolic processes has been demonstrated. In 1997, Professor Lubimov revealed a modifying effect of the activated form of morphine on its toxicity. Experimental enhancement of activity and reduction of toxicity in the initial drug has been demonstrated on the example of well-known psychopharmacological drugs, haloperidol, when they are used biparticularly. In tumor models, an increase in anti-tumor and especially anti-metastatic activity of the classical cytostatic drug cyclophosphamide has been shown. This is a point that particularly interested me in practical terms. I'm often approached by patients who are not ready to give up conventional cancer treatment, but they have great difficulty with side effects. This reduces the quality of life of this patient. Drug chemotherapy, during chemotherapy, bipartic agents have proven themselves well. Here, instead of the law of similarity, similar similibus curantur, the law of equality, equalia equalibus curantur, in used. Essentially, those toxic substances that are introduced into the patient's body and cause a number of side effects are the source of preparing a homeopathic medicine to relieve the symptoms. Based on my practice, simultaneous administration of chemotherapy and bipartic remedy can reduce negative symptoms by 90% according to subjective evaluation. In a number of cases, patients noted that they were able to avoid complete hair loss, which certainly had a good effect of patients' psychological experience of the ongoing treatment. In radiotherapy, the bipartic agent is chosen based on the type of radiation used. When it comes to X-ray, the X-ray is a remedy of choice. According to my observations, it allows us to significantly reduce the negative impact of surrounding healthy tissue, reducing the manifestation of post-radiation inflammation and sclerosis. One clinical example, a woman born in 1967, cancer of the root of tongue with multiple metastases in the lymph nodes of the neck on the right side, stage 4A. Diagnosis made in March 2021. Histologically, squamous cell carcinoma. Appointed radiotherapy with radiolabeled cisplatin at 45 gray. This is first CT, and you can see huge packages of lymph nodes with the say in the center. Her first symptom was an enlarged lymph node in their neck, from which pus and blood began to leak out. Patient decided to use a conventional treatment with homeopathic or bipartic accompaniment. This were cisplatin 6 daily, 1 pill in the evening for 3 months, and X-ray 12 CH daily, 1 pill in the morning during radiotherapy. Follow-up. Oncologist report 2021, complete effect of therapy. No cells with sign of malignancy were found. Conclusion is remission. It only took 4 months. I shall say that she also worked with an oncological psychologist at the same time. On the second CT, no pathological changes, and we see only 1 lymph node of normal size. I'm sure that these possibilities showed interested specialists in this field. After all, we can manipulate of substance in order to change its plasticity by activated form of the same substance. Thank you for your attention. Be healthy and happy. Oh, I'm
Thank you,
correct.
Dr. Alexander. It was indeed a good presentation. And now I would invite Dr. Sethi to please share her views on the presentation.
His presentation is little different from others, and I think something more needs to be added to get sensitized. This is a slightly a newer concept, so maybe something more so that people get connected. Like
Yes.
And I couldn't perceive it so well myself. So, but I think some repeat presentation or some broader presentation will make us more aware. So that's my view of your presentation. Anyway, you have made a lot of effort in creating the evidences of the treatment you are providing, and it is a new value addition to what is already being done.
Thank you.
Thank you, Dr. Sethi. Next speaker, we have Dr. Erfried Pickler from Austria. He'll be presenting a case series on optional treatment with homeopathy for children suffering from cancer. Welcome, Dr. Pickler. You may please share your screen.
Thank you. So, moment. So, here we are. Yes, good evening from Austria and Europe, and thank you to all organizers who do a great work. I'm nearly, 40 years in own practice here in the south of Austria. And in addition, I'm since 25 years the medical consultant for homeopathy at the pediatric oncology department here in the south of Austria. And it's nearly a miracle because we face a lot of attacks by skeptics, and especially in hospitals. I've been president of the Austrian Society of Homeopathy from 2012 to 18, and now I'm again vice president. And seminars and lectures led me to Europe, Japan, China, Dubai, and so on. Well, that's a few of the hospital here, and yes, all the children who are suffering and treated here in the hospital get an additional treatment with homeopathy. So how do I do it? I just have the normal repertorization of the anamnesis and then the repertorization, and the outcome is the individualized remedy. And if side effects during the conventional therapy rises, then they get an additional homeopathic remedy. I will present you Jana, a child in the age of 3.5 years, which has who had the diagnosis diffuse matrix cell B non-Hodgkin Burkitt-like lymphoma. And this is a high risk disease, and only 5 up to 10% have the possibility to survive. She got the treatment, the normal treatment from the hospital, and some days later, she suffered from a stomatitis ulcerosa and infection of the lung with shock. And this results in a 1 week in the intensive care unit, and they put her in artificial coma. Her mother phoned me, this is this little girl, and the reason was because her mother grew up here in my hometown, and I had a contact 1 year ago with this friendly, vivacious, blonde and pale and graceful girl. She was suffering from flu. And now she phoned me and I prescribed her phosphorus LM6 in the morning. And due to her stomatitis, Mercurius corrosivus, and she had a fever up to 40 grade Celsius. And so she got pyrogenium C30 once a day. Next day, extubation was possible, and in the hospital it was the question whether it's coincidence. So she stayed some more days at the ICU, but she recovered, and the second chemo block was possible. But not long ago, she suffered again from strong fever and aches, and strychnos nux vomica. Well, we can overleap it because it's really well known. And yes, this nux vomica against her nausea and loss of appetite and cramping pains in the middle of the abdomen was with no satisfying result. So I administered cadmium sulfuricum, which did a good work. Still, she got as constitutional remedy phosphorus, now in an LM9, and the third and fourth chemo block was possible. But afterwards, after the fifth chemo block, she got aggressive and also slight faintness. And with strychnos nux vomica, it could be decreased. Then anxiety, especially at night, appeared with weakness, coldness, desire, warmth, burning, typical symptoms for acidum arsenicosum. And there, some weeks later, she got the infection with Clostridium difficile, and with severe diarrhea, weakness, and dynamic. And it was again the question to put her on the ICU. Podophyllum and acidum arsenicosum and Tana officinaling, alternating in water every 2 hours, could give her energy again, and the next day stool was of normal consistence. And here's the second time she had the fine experience how homeopathy can work. So the sixth chemotherapy was possible, and end of January, 5 months later, end of therapy. But this wasn't the end, because this little girl, until April 2015, she suffered from recurrent acute infections, but she was still in a good mood. And from here on, the report is only a brief summary of our nearly daily contact by phone or email. A relapse happened of this non-Hodgkin Burkitt, and relapse in the lung, liver, spleen, and abdomen, and still she was in a worst condition. I administered phosphoRLM9 again, and Scrofularia nodosa, a special remedy for Hodgkin lymphoma, and intensive chemotherapy, but with severe side effects from tachycardia and so on. Again, bronchitis, inflammation of mouth mucus with bloody discharge. She took Mercurius. Before, it was better when they dissolved the Mercurius globally in water, but now she said it's better if they take it dry in the mouth. And some days later, a kidney insufficiency and she was nearly on the other side of the world. And doctors gave her only a little chance of survival. But surprisingly slow improvement during the next 2 weeks. And in June 2000, still the tachycardia was, but a general condition was better. And then again, loss of appetite, weakness, despair, vomiting after eating, infections of the lung, and again, everybody who was involved in her treatment was in desperation.
Dear
And
doctor, just to quickly mention that the time is up.
sure,
Request
it's a
yeah.
problem because when I sent you my PowerPoint, I had a time of 20 minutes, and now I've only 10 minutes, and so I had to shorten it, but it doesn't take any long. So a stem cell therapy in August 2015 was possible, but afterwards again anxiety, and she needed acidum and loss of appetite. Alpha did a good work and improved the appetite. And end of September, no pathology was diagnosed in the lung. Beginning of October, Staphylococcus aureus infection, again with a very severe decrease of her energy. And end of October, it was possible after 6 months to discharge her from the hospital. In February 2016, booster factor from the second stem cell transplantation was made. And if we see it, this story of this girl, 5 times she was on a threshold to die, and 5 times homeopathic remedies could keep her alive. And this is this girl. And 1 year later, I met a blonde, fair, friendly girl in my hometown. If I hadn't known about her history, I wouldn't have had any idea about her severe illness in the past. And 2 years later, again, she came to my practice, and I had a short communication for some weeks. And this is what we have to do. The physician's high and the only mission is to restore the sick to health, to cure, as it termed. Thank you very much for your attention.
Thank you, Dr. Pichler. That was a wonderful presentation. Now I would like to request Dr. Sethi for her views.
Very nice presentation. In this, we have slightly, he has given us a different view of the treatment. Earlier, those treatments were, most of what I observed was, other than the last presentation, they were mainly standalone. This is an adjuvant therapy, number 1. Number 2, to remove the side effects of chemotherapy. The toughest part, I think, in the allopathic part is the treatment is more painful than the disease. So here homeopathy helps by at least elevating that agony part and providing little better quality of life, because all the times maybe it is such a disease which require consensus from the family, from everybody, that whether they want to go for standalone or as an add-on therapy. So I think he has tried add-on therapy, and a very good result he has seen. I mean, it's really amazing to see the girl so healthy. And then one thing more I observed, which is very good, and I appreciated the use of LM potency and constitutional medicine. So these two have been found very beneficial for the treatment of carcinoma. So I think we can add more as we listen to other presenters. Very good presentation indeed. My congratulations to you.
Oh, thank you. And for the girl.
Yes, more for her.
Yes.
So our next presenter is Dr. Aditya Parikh. Dr. Parikh is a consultant physician and director of Parikh Hospital, and he is going to present a case report on a case of basal cell carcinoma. Dr. Parikh, you may please present.
Good evening, respected Chairperson ma'am and dear colleagues. Is my slideshow visible?
Yes, sir, it is visible.
Yeah. So the subject of my paper today is a case report of a case of basal cell carcinoma, which was managed with homeopathy. Just a brief introduction about what we are dealing with. Now, basal cell carcinoma is the most common of all cancers, and it accounts to almost 30% of all cancers globally. Now, how widespread and how vast the prevalence is can be gauged by the fact that in the United States alone, every year there are about 800,000 cases, new cases of basal cell carcinoma. Now, what makes it a bit different from the other cancers is that due to its insidious onset, there is no sudden alarm that is rung in the patient. And very often the initial consultation is delayed because a lot of people falsely believe it to be just a eczematous eruption or a warty eruption, and they continue to just wait and watch for a long time, not knowing that it is not a benign skin condition, rather it is a cancerous condition. Now, the treatment options that the patient has conventionally is just surgery. And that is the difficult part, because very often surgery is not easy. Surgery is long, it is cosmetically pretty difficult, and it may not always be very rewarding. The chances of recurrence are quite high. So our patient in this case report is a 76-year-old female. I'll be a little brief. And she presented in the OPD in November 2014 with a painful skin lesion over the right temple. And the morphology was very typical. Even on gross observation, you could see that it had rounded edges, it was scaby, dark, and painful. Now, she had already had this lesion for more than a year. So when she came to us, it was November 14. Since 2013, she had already had it. And it was a biopsy confirmed case of basal cell carcinoma. And she was advised surgery, but she did not want surgery. So her family was quite worried because the lesion was growing quite rapidly. And she was absolutely adamant that she did not want surgery. And that is how they opted for homeopathic treatment. So in the initial anamnesis, we had the past history of multiple diseases. I'll not go into the detail because of the shortage of time. One important feature was she had an hysterectomy for uncontrolled uterine bleeding when she was 48. And the post-hysterectomy biopsy was also not available. Very strong family history of cancer. Brother had oral cancer. Elder sister had breast cancer. Now we come back to the present scenario of the patient. That was on the first presentation. She had severe pain, which was throbbing in nature, and thick pustular exudate from the scabs. Now, you see, the presenting complaint is pretty simple and common, nothing unusual. But sometimes the magnitude of the complaint, the magnitude of the common complaint makes it important, makes it uncommon. Physically, she was chilly with sensitivity to air and desire for sweets. And the first prescription was Hipersulf C30 twice every day. This was 10th November 2014. And after about 3 weeks of Hipersulf, she was much better. Although the lesion was the same in size, the pain and the pustular exudate were much less. So with the improvement, we reduced the frequency of Hipersulf to once daily. Another month later, she was stable. However, there was no further improvement in the pain and discharge. So we had to move higher in the scale to Hipersulf C200, which was given weekly for 3 weeks. And after about a fortnight of the last dose, there were no further improvement. In fact, the pain had aggravated. And there was severe throbbing pain with heat of the part. So we had to move to Belladonna C30 thrice daily. Now, after a week, the pain was much better, but the exudation was persisting. So with the relief in pain, we had to now switch to carboanimalase C200, a single dose. Another dose was repeated after a month with improvement. I'm sorry, I'm being a little fast. So this is the condition of the patient. You see that the lesion is quite large. From the periauricular region up till the frontal region, the entire area is covered by the basal cell carcinoma. Now from April 2015 until March 2016, she received carboanimalase up to 1 m at different intervals. And she received, and it was not that for more than a year we were on just carboanimalase. At times for some acute complaints, we did give other remedies for 2 days, 3 days, such as smaller remedies like Glonoin or Belladonna. And then she was steadily improving. This is the follow-up photograph where the lesion is better. 8th April 2016, for one entire year, she had been stable. However, there was severe acid peptic disease since 3 to 4 weeks. After going through the details of the presenting symptomatology of the acid peptic disease, we now prescribe Lycopodium C30 twice daily. Marked improvement in symptoms. Occasional pain over the lesion was persisting. With the improvement, we reduced the frequency of Lycopodium now to once daily.
Yeah, doctor, sorry to interrupt. But the time
I'll be quick. I'll be quick now.
Yes.
Finally, we moved higher, and I'll just move very fast. So from July 16 for another year, she was only on Lycopodium, and we were giving it at large intervals. Lycopodium 1 m was the potency she was on, and she received 3 doses up to April 2017. There was marked improvement, but there was acute constipation and stringy exudate, and she received Hydrastis C30. And now you can see there was marked improvement rather than any increase. By the 2 years of treatment, the lesion was much better. 2017, both constipation and exudate were resolved with Hydrastis. But once again, the acid peptic disease also remained under control, but there was some increase in size of lesion. So we went higher with the Lycopodium 1 m. Right, there was, I'll just move quickly now towards the end of the case. Acute, she had in 2018 acute bout of bleeding from the cracks, and calendula mother tincture was given locally just to apply. And from August 18 to March 19, she only received Lycopodium 1 m as the main constitutional remedy in this case. And this was one entire year gone through again. And now you can see this is the situation in 2019. So we had a good 5-year follow-up here, and there's marked improvement in the lesion. Patient is comfortable, no pain, no difficulty. Now, what we intend to put across is that are regular remedies, the Hipersulf, the belladonna, the lycopodium, when well indicated and correctly prescribed, they can do great help in cancer cases. We don't always need to be looking for some rare remedies, cancer-specific remedies, as was possible in this case. Also, we have to understand that the indications may change, and then we have to gauge the remedy when the body is asking for a different remedy. We did not start off with the Lycopodium 1M or the Carboanimelis 200 because when she came, she was in a lower vitality state. So first we comforted her with our smaller remedies, and then when we were sure the patient's vitality is strong enough, we went for the higher potency remedies. Now, this case is well managed for 5 years. Unfortunately, after the lockdown, I have not heard from her since 1 year because she lived quite far across. But for the past 5-6 years, she was improving steadily. And the modified Naranjo criteria score in this case was 7, which was quite satisfactory. So with an otherwise poor prognosis, such cases of basal cell carcinoma where surgery is imminent have a viable option in homeopathic management. She was able to avoid surgery, get symptomatic relief, and the cancer was also steadily declining. So this case report is promising and indicates the need for a bigger study with multiple cases. Thank you very much.
Thank you, Dr. Aditya. Now I would invite Dr. Sethi to please share her comments on the presentation.
Aditya, you are grooming yourself very well over the years. I'm observing you for many years. So my compliments for that. And then what I have observed with the your presentation, that a case when it gives symptom, it always have a better possibility of getting relief. Right. You were always getting the symptoms, and then physician also have to be observant. Yes, to give these symptoms. If patient gives symptoms, the physician is observant, our possibility of improvement increases markedly. So I think, and then you have moved very slowly and always following the indications. So what we study, that look for symptoms, give the best indicated remedy. When the vitality is low, don't go for very deep acting medicine. So I think you have followed that, which is great. And I hope that you come in touch with the patient again, and then we can take this study forward. A good attempt, and homeopathy has got a great scope. Only thing is, we need to have our eyes and ears open to keep hunting for the similimum. So I think now you can carry on with your this. I think I just try to contact the patient, I think, if possible.
Thank you, ma'am.
Thank you, ma'am.
Rightly said, ma'am. Now moving on, I would like to call upon our next speaker, Dr. Tanveer Hussain. He's Chief Consultant at Dr. Tanveer's Homeopathic Cancer Care Center, India. He'll be presenting a case report on papillary transitional cell carcinoma of urinary bladder. Welcome, Dr. Hussain. You may please start your presentation.
Thank you very much, ma'am. First of all, good evening to respected chairperson, Madam Sethi, ma'am, and our moderators, Dr. Rekha Thomas and Dr. Mathur, and my esteemed colleagues. Good evening, everybody. Madam, can you allow me to share my screen, please?
You may please share the screen. There's an option below, green box.
I need to find that.
Yeah. AV team, do we have the permission for Dr. Hussain? Yeah, we can see your screen, sir.
Can you? Okay.
Yes.
Okay, thank you very much. Friends, now is it okay, clear?
Yes, sir. Yes, sir. You may please start the presentation.
Friends, my today's topic is papillary transitional cell carcinoma of urinary bladder. It's a case report. This is my center in Punjab where I do practice since last more than 25 years. Now, introduction. Papillary transitional cell carcinoma of urinary bladder starts in the bladder lining and extend into the center of the bladder. Sometimes these cancer stays in the bladder without growing or spreading, but more aggressive types of this cancer can spread to other organs. In conventional medicine, the choice of treatment is TURBT, but it can grow back after its removal. Case report. The patient Mr. X, 55 years male, a known case of high-grade papillary transitional cell carcinoma of urinary bladder, first time diagnosed in 2000, presented on 21st-10-2017, almost about 4 years ago, with severe burning pain before passing urine since 2004. The symptoms were frequency of urine was very high. It was every 30 to 40 minutes he has to go for urination, and he would take about 20 to 25 minutes to pass urine. The burning pain he was experiencing so much, it was so severe that he used to feel as if a river of fire is flowing through urethra. He had history of 5 times TURBT. In 2013, oncologist told him for his bladder exchange. For that, initially he agreed, but later on denied due to its side effects. That time he was given 6 cycles of BCG. In 2017, he was told by the team of the doctors that there is no other treatment except bladder change. At that point of time, he started seeking any CAM, that is complementary and alternative system of medicine, and finally selected homeopathy. Now, what was the purpose of his visit to me? As conventional treatment failed to prevent the recurrence of his cancer, he was anxious about his health. His purpose of visit was, number one, he wants relief from his burning pains and he does not want his cancer back. Now, the past history of the patient. He had pneumonia 25 years ago, jaundice about 23 years ago, and there was itching in the genital area since 22 years and still it is there. In 1980, he got gonorrhea, which was treated with antibiotics that time. In 1990, he met with a road accident, and the oncologist, he told this patient that this road accident might have caused injury to his bladder lining, so it could be the exciting cause for this cancer. In 2004, he had hydrocele of left side, and in 2007, he had herpes zoster. Now, patient as a person, appetite, thirst was normal. There was no specific desires and aversions. Stools were slight constipation. And as far as urine is concerned, there was burning pain in bladder. He was having this severe pain before passing the urination. And it was better after urination. He can pass urine only in the standing position with forward bending. For that, he needs to press his abdomen down and his scrotum up, and also pours some water on the bladder area, and after that he can pass urine. This process takes about 20 to 25 minutes. Burning disappears after this urination. And this process repeats every 30 to 45 minutes. Once he came from the washroom, again he has to go after 30 to 45 minutes because of this frequency of urination. Along with this pain, he gets a lot of perspiration even in the winter. So he removes all of his clothes due to heat sensation inside. Sleep, he prefers to lie on the back, cannot sleep properly due to the frequency of urination. He gets saliva while he sleeps. While sitting, his mouth is open during sleep. Dreams were nothing specific. Perspiration stains linen yellow. Thermals, he is very sensitive to cold and heat. This is an investigation done in 2001. At that time, it was papillary transitional cell carcinoma grade 2. And in 2013, it was high-grade urolithial carcinoma with focal squamous differentiation, and lamina propria invasion was also noted. The all treatment he was taking from Tata Memorial Center, Mumbai. And this is again one more report. Now, as far as the miasmatic analysis was concerned, it was predominantly psychotic miasm. Diagnosis was high-grade papillary transitional cell carcinoma of the bladder. And after taking all the symptoms into consideration, the repeatization chart showed this group of medicines where lycopodium, chimaphila, rustox, thuja, etc. was coming up. But when I took the sexual totality, the clinical totality of this patient, and the most important symptom of the patient that he was able to pass his urine only in the standing position, that too his legs apart and slightly bending forward. Chimaphila was selected in LM potencies. It was administered in the different ascending potencies. So now the materia medica of Chimaphila, in the Blackwood materia medica, he says the urine is often difficult to start, causing the patient to strain. Boric says urging to urinate, burning and scalding during micturition and straining afterwards, must strain before flow comes. Unable to urinate without standing with feet wide apart and body inclined forwards. Herring says constantly disposition to urinate as often as every hour. So it was consulted from various materia medicas and this Chimaphila was administered. Now, after 1 month of his this prescription, he was feeling 50% better in the burning pains and in the frequency of urination, and he was the time taking to evacuate. And as far as the weakness is concerned, it was also improved by 50%. And this patient is under my treatment still now because of the paucity of the time. I am skipping so many slides because it's a long presentation of more than 4 years follow-ups. And now he is totally free from all of his complaints, symptomatic as well as from the pathological investigation reports. Just there is a small video. Just I want your kind attention for this.
बहुत बेहतर हूँ, बहुत बेहतर, बेहतर ही नहीं, बहुत बेहतर हो गया, कोई प्रॉब्लम मुझे नहीं है, हर तरह से फील बेहतर हो गया, जो आज समझिए 40 years के कोई एजेंट हो गया, उससे ज्यादा मैं अपने को बेटर फील करता हूँ.
Okay. Now, how old? He is feeling as active as 40 years of person, though he is more than 55. Now, when I asked about the total complaints, he told me. See, अगर मैं आपको in terms of percentage पूछूं, 100 में से आप अपने आप कितने मार्क्स दोगे? 100 देंगे. Oh, thank you. Wow. He says I would give you 100 out of 100 because he is feeling 100% better from all of his complaints. This is the report, which is a cystoscopy report and USG abdomen report. There is no trace of any cancer, any growth in the bladder. In the cystoscopy, anterior urethra is normal, vesical neck is normal, bladder neck is little high because of his prostate enlargement. The results, he started improving very speedily and was 50% better within just 2 months, and after 7 months his cancerous growth completely disappeared only with homeopathic treatment. He is still in my touch and is living a normal life. Conclusion: the present case showed the rapidity of response to homeopathic treatment when conventional treatment have been unable to give him relief. This case should encourage use of homeopathy in treating patients with cancer of urinary bladder. Thank you very much for patient listening. Thank you one and all for working for homeopathy. Thank you very much. I would be happy if there is any question. I will try to answer those. Over to the moderators and ma'am.
Thank you, Dr. Hussain. That was a wonderful presented case, and very glad to hear the patient's testimony giving you 100 out of 100.
Thank you very much, ma'am.
Okay, ma'am, Dr. Sethi, please, any questions?
Not much questions, rather appreciation. I have heard number of lectures and case presentations of Dr. Hussain, and I really appreciate his efforts in alleviating the pain and problems of patient. Like after listening to all these, I have few points to say. That homeopathy has been proved by all these speakers what they've excellent role in preventive, curative, palliative, and as an adjuvant therapy. What we have to be observant at every point. Sometimes patient may come with very clear-cut symptoms. Sometimes we need to treat him for the time being and let the guiding symptoms to come so that we can, we can take him to the side of curative. And all this only happens with lot of dedication. Homeopathy, I always say one line and I love to repeat it. All system treat, only homeopathy cures. This is my favorite line. And you know, all of you people have cancer, as you know, is a multi-myasthenic disease, a curse of the urbanization and civilization with which we boast with great pride. I think we should try to be as close to nature as possible. And little more I would like to add, like during my stay in Ministry of Ayush, I became very much fan of other systems as well, because once you work closely, you come to know about their good points also. So yoga is a wonderful drugless therapy. Naturopathy is a wonderful therapy, drugless therapy, and then it does not hamper our working. Even I would like to add, you know, about, I really don't know much about Ayurveda, but one thing I like, the rituals they tell the patients to follow are very clearly described. Ritu Charya, Din Charya, and I think we can, you know, integrate all the knowledge, and ultimately our aim is to elevate the pain and problem and financial burden. You know, homeopathy not only gives you relief, it gives you relief, a lot of relief from financial burden also. Any system you try, and especially for carcinoma, it's physically painful, emotionally painful, economically painful. It gives you a lot of pains. But I think homeopathy plays a great role in alleviating pains. And my, applauds to all the speakers. They have really done justice with this session.
Thank you, ma'am, for your very valuable comments. And now I will quickly invite Dr. Srimanti Sanyal, who is a postgraduate trainee in Mahesh Bhattacharya Homeopathic Medical College. Dr. Srimanti, she was supposed to give her presentation in the previous session, but due to some technical problem, she couldn't. Now, without wasting much time, Dr. Srimanti, start.
Thank you very much for giving me the opportunity to present my slide in this session, and very sorry for the previous inconvenience. I am Dr. Srimanti Sanyal, PGT, Department of Case Taking and Repertory in Mahesh Bhattacharya Homeopathic Medical College and Hospital, West Bengal, India. And my topic of presentation is an open clinical trial on a role of homeopathic treatment in painful diabetic neuropathy. As ma'am said a little bit a while ago, that pain is a very symptom which keep the man very much demoralized. So diabetic neuropathy is also a type of pain which is defined as the presence of symptoms and or signs of peripheral nerve dysfunction in a patient with diabetes after the exclusion of other causes. In course of diabetes, some 50 to 90% of individuals eventually develop diabetic neuropathy, and of these 15 to 30% will have painful diabetic neuropathy. The pain is characterized by tingling, burning, and sharp shooting, lancinating, like an electric shock-like sensation. So this is a typical distal symmetrical sensoromotor type of neuropathy, which may be a reason of withdrawal of recreational and social activities, and may be associated with depression, along with a very high monetary burden for a patient who is always already he is diabetic and taking many medicines for this reason. So the research question was, can homeopathic treatment produce any significant change in management? The null hypothesis and alternative hypothesis has been taken as followed. Aim and objectives. Aim was to evaluate whether homeopathic medicines can produce any significant improvement in treatment of painful diabetic neuropathy. And there are various other objectives, like to find out the socio-demographic characteristic of patients, to evaluate quality of life score of the patient using the SF36 questionnaire, and to assess the efficacy of individualized homeopathic treatment, and to shortlist the most useful homeopathic remedies. The study is an open-label prospective observational pre-post comparison clinical trial in Mahesh Bhattacharya Homeopathic Medical College and Hospital, where the samples were selected from the OPD and IPD, and the sample size was calculated to be 38 finally, with a study duration of 18 months, where each patient got 3 months of follow-up. So the inclusion criteria are as follows. The cases suffering from painful diabetic neuropathy and age over 30 years with HbA1c more than 6.5%, and person not taking any other homeopathic medicine, both sexes and literate patients. Where exclusion of the patients with diabetic neuropathy or other kinds of diabetic neuropathy or neuropathy due to other diseases, other causes, patients suffering from any other neurological disorders. In the patients where typical Charcot joints have been developed, other complication of diabetes like retinopathy, renal involvement, or history of recurrent acute complaints like hyperglycemia, ketoacidosis, etc. And patients suffering from any other chronic debilitating disorders, psychiatric disorders, lactating mothers, immunocompromised patients, etc. So the procedure was like the patients were diagnosed with DN4 questionnaires and detailed case taking was taken. Relevant clinical examination and investigation was done, and evaluation of symptoms was done. Miasmatic background analysis was done, and selection of medicine was done in consultation with synthesis repertory followed by homeopathic materia medica, and observing the patients through change in symptoms and lifestyle has been reviewed. The response was duly graded as per scoring scale. Intervention, both centesimal and 50 millisimal potency medicines have been given. The primary outcome measurement was through the visual analog scale for pain, and the secondary outcome was using the SF36 questionnaire for quality of life index. So follow-up was asked every month, but the scores were taken in the baseline and the third month. Statistical analysis is done thereafter. The result and observation, in this study, the demographic data has been obtained from the study, which has been showed in the box, the age group, sex, marital status, etc. And the treatment taken and comorbidities and blood pressure, etc. also has been taken in consideration. So primary outcome, to test the statistical significance of effectiveness, the primary outcome has been done using Wilcoxon matched pair signed rank test, where the interpretation, the results of the statistical analysis show that for the period between baseline and the 3 months, the decrease was observed in the painful neuropathic condition was statistically significant. Therefore, null hypothesis was rejected and alternative hypothesis was accepted. This was scoring. VAS score has been taken at baseline and 3 months, and the ranked test has been done. This was the primary outcome. And the secondary outcome was done using the SF36 questionnaire. In SF36, there are 9 different domains like physical functioning, role limitation due to physical health, role limitation due to emotional problems, energy fatigue, emotional well-being, social functioning, measurement of pain, general health, and health change like that. So all the domains had been calculated separately using two-tailed paired t-test. The mean values were taken at baseline and after 3 months of investigation. After doing the paired t-test, all the domains were statistically significant. And the medicines which were frequently indicated were Silesia, Staphysagra, and acid nitric lycopodium, sulfur, natrum mute, medorinum, causticum, thuja, lachesis pulsatilla, ruta, and colocynthis. So conclusion, homeopathic treatment for painful diabetic neuropathy with selection of individual's remedy with help of synthesis repertory produced improvement in symptoms of pain as evident from significant decrease in pain score. But as the sample size was small and it was not a randomized control trial, I will try further to do a more intensive study or a randomized control trial with a larger sample size. Thank you for giving me the opportunity. Thank you, LHMI, for giving me the second chance. Thank you very much.
Thank you, Dr. Srimonti. Actually, this is, Dr. Rekha, would you like to add something?
Thank you. Dr. Sethi, ma'am, would you like to summarize?
I like to just say a very short few words. She has done a lot of effort for this, but I think due to the paucity of time, she has to simply rush. So I think she can just, after some time, she can spend more time and have a little bigger size and present the study again. This is a very important, during our clinicals, we see the discomfort of the patient, and diabetes has become so common that over few years, many patients come for this. So this needs to be addressed, and she has actually taken a topic which is friendlier in our daily OPD. So, I mean, I really admire and appreciate her effort, and I wish that she gets an opportunity to present it at layer and peace. So you have done a great job, beta.
Thank you, ma'am. Thank you. Thank you very much. Actually, due to shortage of time, and I had to rush a bit.
So do try for a second opportunity wherever you get.
Thank you, ma'am. Thank you.
Thank you. Thank you, Dr. Sethi, for summarizing it, and Dr. Srimonti for your wonderful patience. So, dear friends, let me take this opportunity to simply conclude and give you a small proposal vote of thanks. So it was a wonderful session, everyone. Thank you all the speakers for presenting your valuable findings and research studies. On behalf of LMHI, I Sneha extend my hearty gratitude to the Honorable Chair, Dr. Sethi, for very thoughtfully chairing the entire session. And respected moderators, Dr. Rekha Thomas and Dr. Mohit Mathur sir, and also the session coordinators, Dr. Harshita and Dr. Visamaya, for doing a wonderful job and for completely coordinating the session. And also thank you, delegates, our viewers, and most importantly to the AV team, the technical team, for helping us running the session seamlessly. So thank you all once again. And now before we move to the next session, let us quickly capture a group photograph and let us capture this moment. So request everyone to switch on their cameras, and our technical team will tell us when they click a photograph. Request everybody to switch on their cameras, put on a beautiful smile on their faces. That's wonderful.